Hi everyone, myself Dr. Kumar Gaurav, and today I will be talking about impacted wax. We'll start with the introduction. Earwax, the cerumen, is a natural protective oily substance which is produced in the outer third of the ear canal. Its function is to remove the small foreign particles such as dust from the canal. It is achieved by the ciliary hairs. See what happens, the wax is composed of secretions of the sebaceous glands, the ceruminous glands, hair, desquamated epithelial debris, keratin and dirt. Sebaceous and the ceruminous glands open into the space of the hair follicles. Sebaceous glands provide fluid rich in fatty acids, while secretions of the ceruminous glands is rich in lipid and pigment granules. The primary components of the earwax are the final products in the HMG-CoA reductase pathway, namely the squalene, the elanosterol, and the cholesterol. Well, let's talk about the wet wax and the dry wax. Wet wax, it is light or dark brown and sticky. It is the high concentration of the lipid, around 50%, and pigment granules are present. And it is found in Caucasians and Africans. Whereas a dry wax, it is gray or tan and brittle. And it contains around 20% of lipid as compared to the wet wax. Well, it's found in Asians and Native Americans. Now let us talk about the functions of the earwax. Number one is the cleaning. The cleaning of the ear canal occurs as a result of the conveyor belt process of epithelial migration, aided by the jaw movement. Cells formed in the center of the tympanic membrane migrate to outwards from the umbo at a rate equivalent to that of a fingernail growth to the walls of the ear canal and accelerate towards the entrance of the ear canal. The cerumen in the canal is also carried outwards, taking with it the dirt, the dust, the particulate matter that may have gathered in the canal. Jaw movement assists the process by dislodging the debris attached to the walls of the ear canal, increasing the likelihood of extrusion. Now, second point is the lubrication, its function. The lubrication prevents the desiccation and itching of the skin within the ear canal, known as steatosis. The lubricative properties arise from the high lipid content of the sebum produced by the sebaceous glands. So, lubrication of the EAC helps to entrap the foreign material. Now, third function is the antibacterial and antifungal roles. Well, the recent studies have found that the cerumen has a bactericidal effect on some strains of bacteria. Cerumen has been found to be effective in reducing the viability of a wide range of bacteria, sometimes up to 99%, including the Haemophilus influenza, Staphylococcus aureus, and many variants of the E. coli. The growth of two fungi commonly present in the otomycosis was also significantly inhibited by the human cerumen. These antimicrobial properties are due principally to the presence of the saturated fatty acid, the lysozyme, and especially to the relatively low pH of the cerumen. It is typically 6.1 in normal individuals. Now, well, if we talk about definition, the excessive collection of the thick earwax is known as the impacted wax. So how this impacted wax looks like, so you can see here. So what are the symptoms patient gonna present you with? It is a diminished hearing, often of sudden onset after cleaning the ears. Discomfort seldom, complaints of pain unless the wax is pressing onto the eardrum. Tinnitus occasionally. Now the educational points, the wax is normal physiological substance which has an important role in protecting the ear canal. The ear canal is a self-cleaning system. Do not use cotton bud as wax is more likely to be pushed back against the eardrum and become impacted. Earwax only needs to be removed if it causes symptoms or if a proper view of the eardrum is needed. So what is the primary care treatment? In most severe cases, use of a ceruminolithic eardrops for 4 to 5 days prior to the syringing is advisable. Removal, removal of the wax, removal with the wax hook is an option also available. So here you can see this is a from by Cerumen hook and scoop. Well, normally we can use a Jobson horn probe for the same purpose. Self-care, the ear drops to soften the ear wax. Ceruminolitics may be used as the only treatment in mild cases. There are many different preparations of the market, none with any clear clinical advantage compared to the others. Well, sodium bicarbonate may be effective at disintegrating earwax. A simple home remedy is olive oil warmed by pouring onto a warm spoon. The preparations containing the organic solvents are particularly likely to cause irritation and inflammation of the external ear canal and should be avoided. Let's talk about the ear irrigation. The ear irrigation to improve the hearing in those with the impacted wax. The lowest possible pressure should be used. It is best avoided if the eardrum is known or suspected to be perforated. There is a history of mastoid surgery or a chronic middle ear disease. In patient has a unilateral deafness, a history of recurrent otitis externa or tinnitus. This is the syringe, ear irrigation syringe. This is how the ear irrigation is being done. And this is the wax being removed by the use of the microscope after the auto microscopic examination. Thank you.